Welcome to Petability. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Chris. How are you doing today?
And a fine morning to you, Kathy. I'm doing really well because I know what's coming up.
I know. Well, listen, I know. You have been so generous in letting me take the limelight in not just one podcast, but two podcasts. And so finally, my friend, it is your day to shine because we are going to be interviewing you today, or I am going to be interviewing you today about the similarities and differences between PT for people and PT for animals, or physical rehabilitation actually for animals, and how it translates, because it really does, doesn't it? It really translates from one to the other.
Yes, it was actually my brother-in-law who suggested, he doesn't even have any pets, Kathy. And he said, I love listening to your podcast because I learned so much about me and what I should be doing. He said, Chris, you do a fantastic job of making analogies between the pets that you're rehabilitating and people. And so, for example, warming up and cooling down, and, you know, all of those basic things that apply to really anything. But, you know, people and our dogs and cats, you know, we're all mammals, right? And so we can all benefit from the same thing. So he actually suggested this topic. And then I finally got brave enough to ask you.
I'm glad you did, because I think that people can relate to that, especially when we're saying things like, well, you know, imagine if you lost, you know, the range of motion in your knee. Think about how that would be for you to climb stairs. And so they can, you know, so I'm excited to talk about this and how it translates between physical therapy and physical rehabilitation between animals, because I think we can all relate to that. And I think you're the perfect person to do that. You know, I think that we had talked previously in probably our first podcast about a collaboration that we've had now going on for probably 20 plus years. Chris is one of the most talented rehabilitation practitioners I've worked with. And that's why I hook my wagon to her star because of how talented she is, and probably one of the hardest people I've ever met.
Kathy, I have to interrupt you here because now you're setting this up and people are like waiting with bated breath. I don't want them to be disappointed. So let's manage expectations and just hope you enjoy the show.
Chris is the worst. So Chris is the worst. So I think you're the perfect person to talk about this with, honestly, because of your experience with treating people and treating animals, and your talent with treating animals. And, you know, I'll tell you a brief story about when I was going through CCRP school, and I was in the very first graduating class. And so in those days, you had to do, if you were a technician or a veterinarian, you had to do your rotation, your externship with a human physical therapist. And I almost died. It was awful. You know, with this, I was going to say the owners, with the client's permission and you know, supervision from the physical therapist, I treated a woman's foot.
Yeah, people usually find feet kind of disgusting.
It was a nice clean foot. She had good, you know, she had nail polish on. It was a nice and clean foot. But I was like, well, what do I do with this foot? And then I just was like, you know what? You apply everything that you've learned about animals and what you would do if they had a sore foot to this woman's, you know, treatment. And it worked out okay, but it was a little scary, but it translated to me. It translated. What would you do if this was, you know, a dog with a foot or a toe injury? So I made it through, and it was difficult.
Ironically, a lot of my career as a physical therapist was in sports medicine. There was a huge population with foot problems because of, you know, running and jamming their toes into the little rock climbing shoes and things like that, because I was in Colorado, and the student population there at the university where I was working, you know, did like 5 activities a day, or they were slackers. Activities meaning high-level sports activities. So, you know, I did a lot of orthotics and things like that. So I've seen more than the average person's share of feet, that's for sure. And fortunately, they don't gross me out. So,
well, that's great, Chris. Good. Let's just jump right in and talk about how you're transitioning careers. How did you transition careers? And it wasn't really a big leap, right?
No, it wasn't. I moved across the country from Colorado to New England, and I thought, well, this is a chance to maybe do something a little bit different. And I didn't know what that was going to be, but I was gravitating toward working with elderly people, which was vastly different from like I said, the young student population at the University of Colorado, or animals. That's kind of the two directions. And I thought, let's really shake it up. Let's see what there is in the animal world. And fortunately for me, they were just starting the certification program through the University of Tennessee. And so I kind of went whole hog, if you will, and, took my first class. I was hooked. Then that's when we met, because I volunteered at the facility that you were managing. And the rest, they say, is history. And, I think certainly my skills as a physical therapist, it was just applying those same principles to a different species. So the PT part made total sense to me. That was not difficult. What I needed to do is learn the differences, focus on the differences. And of course, I'm used to people that could give me a quote subjective report, right? What's hurting? Where's it hurting? And now I'm working with animals, and it was actually kind of a little bit easier, because one of the things we say when working with people is, quote, don't taste pain. Pain can be a liar. And so, where the pain is isn't always where the problem is. And with animals, you have to look at it very objectively. And so that was kind of a relief for me. The other thing is just, again, the body language, the communication, as I alluded to, but also just the differences in anatomy, the differences in disease processes. And there were a lot of similarities, to my surprise. I mean, the anatomy differences between a human and a pet are very few, really. And a lot of the disease processes are similar, but if they're not exactly, we could make an analogy to the human side. So that's what I focused on for the certification. It wasn't a big leap for me. So I felt fortunate. I think, and you can speak to this, Kathy, I think for a lot of the veterinarians, basically, the animals on that side, and I certainly don't, but learning an entire profession, if you will, can be challenging. And I think that's why our collaboration has worked so well, because so much about handling and different species and the disease processes and anatomy. And I fortunately knew the PT part, so we're both learning from each other on the opposite side of our profession.
Right. And I think that actually makes for a perfect marriage when you're looking at a patient. Who do you have on that patient's team, right? Who's on team Matt? His veterinarian, his physical therapist, which is Chris, and his veterinary technician, which is his mother, right? And we all bring something a little bit different, right? We all bring something a little bit different. And sometimes I'll bring up something that you hadn't thought of, and sometimes you'll bring up something that I'm like, hey, I never thought of that. And I think that just makes for overall better treatment of patients.
Oh, I agree 100%. And when people look at me like I have three heads, and they're like, you do what? And I'm like, I'm a physical rehabber with small animals. And again, talking about the similarities, I say, well, have you had PT? And they're like, yeah. And I said, did it help? Yeah. And I'm like, well, don't you think that might help your pet if, they hurt their knee or they're getting arthritis? Oh, yeah, that makes sense. So generally, because they're always confounded about what we actually treat. And I say, if, anything that we can treat on the human side, we can treat on the animal side.
Right.
And once they start thinking about it, I'm like, neurological issues, cardiac issues, obesity, certainly orthopedic, challenges. So it's just a matter of kind of pointing out those similarities, and then they get that aha.
The aha moment, yeah. Would you say that working with animals, Chris, does it liken anything to maybe maybe at pediatrics, given the nonverbal and watching for, or communicating in a nonverbal sense and watching for what the patient is telling you?
Well, absolutely. And I've never done peds because I thought it was terrifying. And so when I learned about treating pediatrics, in PT school, I'm like, oh my gosh, there's so much responsibility. I also didn't enjoy neurological issues on the people side, but that is what I'm gravitating to with our animal friends. We had a colleague, Betsy, that we both worked with, and she was certified in pediatric physical therapy. I think she's the first one that pointed that out to me. I'm like, oh my gosh, you are so correct. You rely on the parent, whether it's the pet parent or the child's parent, for the subjective, telling, what is wrong, kind of filling in those gaps, helping with that communication. What are their observations? And then again, because the child, as you said, may be nonverbal or unable to exactly articulate, you really have to be observant and look at those objective signs and, getting to the root of what's wrong. The other thing is, we never want to do something noxious, right? We can't communicate to a toddler like, I'm going to put this needle, in your arm, and it's going to sting a little bit, but it'll just be a second. I mean, they see that needle coming toward them and it could be terrifying. And based on maybe a past experience, with a needle or a previous vaccination or what have you. So, in the pediatric realm, they do all of these things to make it so positive and fun, and the experience of going to the pediatrician or the physical therapist that may be working with them, all these toys, the bouncy balls and playing with things and having to grasp and move and lift. That's all physical therapy, but they just think they're having fun.
Right.
We do that same thing on the animal side in terms of trying not to make things noxious to the best of our ability, making it a positive experience, because you can't, again, explain the potential, consequences. And I think you've said, Kathy, if I get a cookie every time I do something great and people start cheering, you'd work really hard as well. So our dogs definitely enjoy, and they think they're just having a blast when we take them through these quote games and such, right?
I have no idea they're actually performing an exercise. You have no idea. I think the reading the body language of pediatric or young children, babies and toddlers, is very interesting to me. And I wonder if I could read the nonverbal behavior of a small child, much like I do with dogs or cats or birds. And is there a similarity in facial expressions and body language?
Oh, I think so. Many a parent to a little human has told me, they can distinguish their cries, right? Is it because they're hungry? Is it because they need their diaper changed? Is it because they are tired? We know in our world that the pet parents can distinguish, the various barks. Is it because somebody's outside? Is it because they want your attention? Is it because, something is uncomfortable? Whatever it may be. So as, their parents, whether it's people or pet, I think they're the number one advocate, right? And kind of doing that communication piece between their charge, again, whether it's a baby or a puppy. And what they do at home is so important, because when a parent brings the pet into the clinic, they may act completely differently. The adrenaline's pumping, they're masking their pain, whatever it may be. So you listeners out there, we really value, what you tell us, and taking pictures, taking videos, because what they do at home and what you're interpreting, best. So don't minimize that.
And not dismissing what the owner says, not dismissing like, oh, she didn't take her cookie last night. Well, maybe there might be a reason for that. So I don't want to dismiss anything that they say. I want to take that all in.
Right. It could be very meaneful. Yeah.
It could be very meaningful.
And as you said earlier, the team, so the pet parent is definitely part of the team, and the vet and the rehabber. Yeah. Well, I was just going to say one more thing. When we started out, Kathy, the whole career profession of physical rehabilitation for animals was pet parent driven.
Right.
We really had to advocate what we could do with the veterinary community, because it was a new subset, a new profession within the veterinary realm at that time. And, people have been doing it, quote, on the side, and, because they saw the need, but to formalize it. And then even after it was formalized, demonstrating our value, showing that there were better outcomes, that the pets were getting better faster. And it was those pet parents that were calling you, were calling me, and realizing, my dog's limping. Is there anything we can do? I've already taken them to the vet, and they said, just rest him for 2 weeks, but it's not working. They're still limping.
Right.
So
right.
the next step was, the physical rehabilitation.
Right. And I can't thank the pet owners enough for that, really. It is client owner driven. And sometimes still, even within our profession, maybe colleagues or other veterinarians who still don't refer to physical therapy, and owners are pushing for it. And then they will send. And then when when the vet sees the benefit of how great this pet is doing, especially our senior pets, when they're losing their balance or losing strength, and then you start to see how well they're doing, and picking up their toy again and maybe going for a little walk again. I mean, that sells the whole thing, right? That these animals are engaging in things that they enjoy, and that engaging in things that the owner and they can do together, right? And when you see that, you can't deny it, right?
And Kathy, you mentioned you were in the first graduating class. Was that in 2000?
2000. It was either 2002, 2003, I think.
Yeah. And fortunately, in that time, the physical rehabilitation has become much more a standard of care, though. I remember back in the day, I'd have to write letters and explain who I was and so forth. And now I'll request a referral, and they're like, yep, great, go for it.
No problem.
Because they have, many times realized our value. Like you said, there's still some challenges out there, but. And I also, people have heard us talk about physical therapy and physical rehabilitation. And I want to make that distinction. Physical therapists use the term physical therapy, and it's a protected term. When we're working with animals, the certification programs have deemed physical rehabilitation to be more appropriate, because that encompasses all the players, including the non-physical therapists that are performing rehab with the animal population. So the vet techs and nurses and the vets, as well as the PT side.
PTA.
So that's why we're kind of, juxtaposing those and so forth. But I just wanted to mention that as well. So it's the same, but just a matter of semantics.
I'm glad you cleared that up, because I think in almost every podcast we refer to ourselves as rehabilitationists or rehabilitation therapists, and that is definitely different from the protected term of physical therapist.
Yes, although because I am a physical therapist, I will use that term. I can. Hey, Kathy, I do have a funny little story to tell, because this was all so new, 20 years ago. I remember talking about rehab. They say, what do you do? And I said, I do rehab. And I still get this. And they're like, oh my gosh, like, my dog can get addicted to their drugs. Like, you do rehabilitation, like AA or NA or something. I'm like, no. Or behavior, a lot of behavioral rehabilitation, like mental health issues and things like that. And not to minimize that, but I did have to clarify, no, physical. If I leave off the physical part, say I just do rehab, it gets confusing to the average person that may not have been exposed to it.
Yes, you're going to get a call. You know what, Chris, my cat is hitting that catnip just a little too hard.
I think it's a 12-step program for that.
Yeah, I think so. Well, why don't we go ahead and move into what the anatomy differences are between humans and between your human patients and your animal patients?
Sure. And, I'm sure there are some that I'm not familiar with in terms of, organ sizes and, positions and things like that. So I'm going to, stick to the kind of skeletal and muscular anatomy. And there were just a few things that I found fascinating as I was learning more about our pet friends. And I'm going to basically, most of my population tends to be dogs. I'd say a good 99%. You, I know, have the luxury of treating many other species. So basically, these comparisons are going to be between our canine friends and humans. So one of the things that I thought was really interesting was that dogs do not have a clavicle or a collarbone. And
they do not.
They do not, but people do. And I know this very well because I've broken mine 3 times. And sometimes people are like, how did you do it 3 times? You only have 2 collarbones. I'm like, well, 2 on the right side, 1 on the left. But so I guess dogs don't have to worry about those clavicular fractures. And I don't know if it's just an evolution thing. I have no idea, but I just thought that was really interesting. And I told this story before. I went to the University of Iowa, and there was a wrestler there that was born without collarbones, and he was very good. Obviously, he was competing on a national level, and a lot of the wrestlers from Iowa go to the Olympics and so on. And but I think because he didn't have collarbones, he could really squeeze and twist and move around and get out of those holds. So the other thing that I found was interesting is the hamstring of a dog is very, very important. We think oftentimes about the quadriceps in people, our thigh muscles on the front. In dogs, I feel like the hamstrings on the back of the thigh is really significant, and it actually goes from the rear end where their sit bones are all the way down to their ankle, whereas in people it stops just below the knee. So I just again thought that was interesting, a little bit of trivia there. And my final comparison has to do with the pet's forelimb. So I mentioned before that their anatomy is very similar to ours. So they have a biceps and a triceps. So the biceps is on the front of your arm, when you do your 12-ounce curls, right? And get big guns, if you will.
Mm-hmm.
And the triceps is on the back. Well, because pets are quadruped and we're bipedal, I think that, again, evolutionarily, things have switched up a little bit. So by the name biceps, we have 2 muscle bellies on the front, triceps, 3 muscle bellies on the back. Our dogs have only 1 bicep, so it's a complete misnomer, and 4 triceps. So I'm thinking maybe as we became more upright as humans and started doing things with our hands, that we needed more lifting muscles. And so one of those muscles of the triceps actually migrated around to the front to allow us to be stronger, to be able to lift, to be able to throw, and so forth with our arms. Whereas our animal friends are basically in a quadruped position and what we call closed pain, so their feet are down on the ground. So they need those triceps to stabilize them, prevent the elbow from bending, support the shoulder girdle, because they have so much weight on their front legs, 60% in a perfect world versus 40% in the back. So,
well, Chris, this leads me to another question about some of the differences. I mean, can you talk about the biomechanical differences in your humans versus your pet patients?
Sure. Yeah, and I hope this isn't getting too technical, because I like to geek out on this stuff. But yes, I alluded to some of the biomechanical differences. Basically, they're quadruped, we're bipedal. So
when you say quadruped, you mean all 4 feet?
Oh, yes, right? I do.
And when you say bipedal, you mean 2 feet. Okay.
Yes. So, it's interesting too, because people will say, my dog hurt its front knee, and they don't have a front knee, they have an elbow. So their forelimbs are like our arms, and their back limbs are like our legs anatomically. And so that's a very good point that you make. So quad being 4, they're on 4 feet, and we're biped, we're on 2 feet with arms and hands. I do tend to juxtapose those a lot with my pet owners. I'm like, oh, his hand is sore, because again, they can kind of, appreciate, what I'm talking about there.
Right.
But because of them being quadruped, I already said that, like, their shoulder girdles are much more pronounced. They are putting a lot of weight and stress, and basically those shoulder blades, their scapula, are sliding. They have the ability to slide on their rib cage, so they need a huge muscular support system to be engaged, to keep their front limbs where they should be when they're walking and running and jumping. And the front legs are basically our stoppers, or their stoppers.
If you're going downhill, to keep your body from going forward over you, you're going to use those shoulder muscles.
Absolutely. And in the patient population on the human side, for that reason, we saw a lot of shoulder dislocations. It's a ball and socket joint. And we don't typically have a lot of muscular development around our shoulder girdles. And so I remember one patient I had, he simply reached up to, like in the old days, like turn on the dome light in his car or something, and dislocated his shoulder.
Oh my God.
So, these very benign everyday activities, can cause that. Have you ever treated a dog with a shoulder dislocation?
I've never had a dog reach up to turn on a dome light.
Well, no, that's true. But we see hip dislocations in dogs.
You most often see hip dislocations. I don't know that I've ever seen a shoulder dislocation. Yeah.
Right. So we're much weaker, up top. They're much stronger in their front. And then it's rare to get a hip dislocation in a human, but rather common to get a dog dislocation.
Right.
Just again, based on the anatomy and the musculature and so forth. Another fascinating thing, and we both talk about this a lot, Kathy, is the fact that dogs stand on their toes, and that's called digigrade. In their back feet, their heels are not on the ground. That's the first little bone you see in the back. That's their heel. So it's like being in a stiletto all the time without any support. So, they're standing up on those toes, and in the front, their wrists are off the ground. If we go to do a push-up, our wrists are down and our hands are flat. Right. So our feet are plantigrade and there's a digigrade, and that can cause a lot of potential problems in terms of, think about all the little bones in your hands and feet, which have correlating ligaments that hook bone to bone, tendons that hook muscle to bone. So again, similar across species, but just based on the fact that they're up on their toes, so much more potential for injury in tearing a ligament or, avulsing a tendon or what have you. So,
and those middle toes, those are the weight bearing toes. I mean, if you think about it, those toes have a lot to do, those middle toes.
Yep.
It's a lot of work.
Yes, absolutely. And, we always talk about traction and, giving our pets every advantage, nail trim so that they're protecting those toes. And you just can't minimize that. I think so many pet owners don't really think about their pets' toes and feet as much as they could or maybe should. Yeah. And I've been traveling recently, and I returned back to work yesterday after about a month. And out of the 4 patients that I saw in their home, 2 of them needed nail trims. Right. So that just, 50% were in need of nail trims, and I was all over it because it's so, so important.
This is a great time, Kathy, to bring up our fantastic sponsor, a Dog's Best Life Box.com, that has enrichment kits designed to not only entertain, but also tire and fulfill your dog while creating an unbeatable bond.
If you're thinking about getting a subscription or a one-time box, go to a dogsbestlifebox.com and use that promo code PETPOD22. That's PETPOD 22 to get that 10% discount and the special gift,
which is a fantastic treat pouch.
You want to talk a little bit about the cruciate ligament? We've had many pet owners say that their dog got the ACL.
Got the ACL, yep.
And and more power to them. I mean, at least they're listening, to the vet and things like that. So they're hearing that, it's like, what's wrong? What brings you into the clinic today? Well, they have, ACL. Well, the truth is that they have 2, and in the dog, it's called the CCL, or cranial cruciate ligament. ACL in people, we do mix and match, but I'm sure many people use that term ACL because they've heard it like in the sports world. And so,
right, they can relate it to themselves.
Yes, and it is part of normal anatomy. So when they're saying that their dog got the ACL, what they mean is that it has torn. And that is a very, very common injury due to their biomechanics in dogs. So again, we tend to think about a sports injury, a skier that catches an edge, or a football player that gets, hit in the knee and they tear their anterior cruciate ligament, or ACL. Nice. In dogs, it tends to be more of a wear and tear process based on anatomy, physiology, and so forth. So oftentimes when it fully tears, it's kind of like the straw that breaks the camel's back. it may have been a process has been going on for a long time, and then tears. And historically, that owner may have looked back and said, yeah, I remember like 2 years ago, they were limping, for a few weeks, but then it got better. And then, 6 months later, I remember they were limping again, but it got better. And then now this time it's just not getting better. And so they tore some of the fibers of their cruciate, and then a little bit more, setting off an inflammatory process, and then maybe finally fully tore. And that's because that ligament is so important for keeping their shin bone under their femur. And with every step they take, a dog takes biomechanically, they are putting a stress on that ligament.
Mhm.
And if their knees or stifles are really straight, there is more stress.
Mhm.
So, that's something that we can, maybe hedge. I just had a consult on Monday with a pet owner who got a new puppy. And I think the puppy's about 7 months old. And the veterinarian at the initial exam said, that Aurora is kind of loose ligamented.
Mhm.
And there's really nothing that can be done. That's just who she is, and so forth. So the owner reached out to me and said, is this true? And I said, I tend to kind of disagree. So I started them on some very low impact body awareness, strengthening types of exercises, because I did see that Aurora does have very straight stifles. And I warned the owner, I said, she anatomically may be set up for a future cruciate ligament injury. And I thought that was my duty, so that she could, manage her activities and do things like warm-ups and cool downs. And exactly.
Yeah.
To try to prevent. So
let me ask you this. Do people get intervertebral disc disease like dogs do? Does that happen in people?
Well, absolutely.
It does.
The big difference is people don't become paralyzed, whereas dogs can.
Yeah.
So, we know that back pain, I think, is the number 2 diagnosis to mental health. So mental health is the number 1 currently in the United States, and back pain is number 2.
Wow.
I think that in our pets, back pain is often ignored. I think when they do have back pain, we assume it may be a disc, but there's also mechanical back pain that can be due to, a pinched nerve or something not articulating correctly. And again, that's where a skilled therapist can try to discern and, do certain techniques to maybe help that. It may not actually be a disc, but intervertebral disc disease, as the name implies, means that it can be a sudden explosion of the disc between the vertebrae and bruise that spinal cord significantly and lead to paralysis. Or it can be a different type of wear and tear process. Dehydration typically happens in older pets and causes a compression, which then affects the nerves and is painful. When it happens suddenly, surgery is often indicated to decompress to prevent that paralysis. When it's a gradual wear and tear, we tend to treat it more conservatively, like we would in a person.
Mhm.
But it's very similar in that people with, they say they get sciatica, right?
Mhm.
Well, that's pain down the back of the leg. And that usually stems from a pinched nerve, a nerve root in the lower back. Again, our animal patients can't tell us that.
Right.
They can't say that their leg is hurting. The reason that they're limping is not because of a cruciate injury, but actually it's emanating from their back. So, a very thorough musculoskeletal exam is important. And I think, to the defense of the veterinarians that are seeing, dozens of pets in a day, different species and so forth, they can't know everything and discern that in the snapshot of time that they have in an exam room. So having the wherewithal to then refer to the musculoskeletal experts, i.e. the rehabbers, to, figure this out over time. And I think that's one of the perks, is that we typically see the friends of in our pet world on an ongoing basis, right? We may see them, once a week, twice a week, 3 times a week if we're lucky, but at a minimum, maybe every, 2 to 4 weeks on an ongoing basis. We also do home plans with the pets. So the pet parent executes a home plan, and it's as much what not to do as what it is to do. So I think a lot of times when people hear physical therapy, they think, exercise, exercise, exercise. And that is just one small facet of what is done in rehabilitation. They may think use of machines like ultrasound, e-stim, in the animal world using hydrotherapy, again, one facet. I think that where we really shine is, again, the use of our hands, our observation skills, and our education to the pet parent on what to do or not to do, i.e. the home plan. So it doesn't even, I don't say home exercise plan, I should say home plan.
Yeah.
What do you think about that?
And we're assessing, I think that there may be a misconception, I'm not sure, but there may be a misconception, that that animals that come into rehab are going to exercise, but that's not necessarily true. Some dogs maybe, yes, but no, everybody's an individual. I have to assess your home life. What surface do you live on? I have to assess your mental status too. Are you feeling, is that pet feeling depressed or anxious? Is he having, what's his cognition like? Is that dog having cognitive problems? And then we have to help the owner. Does the owner need help getting the dog up? What kind of harnesses are going to help with the dog? Does the dog need a wheelchair? What kind of wheelchair do you need?
What's the owner capable of?
What's the owner capable of? It makes me think, you were talking about it. I was thinking, how many times have I seen a dog come in, that's been diagnosed with a forelimb problem, but it's actually coming from neck pain, and it's not actually the forelimb, it's referred pain, from the neck. So I think you're right. I think that's where we come in, with our hands, in our exams.
And we use our hands to assess and examine, but we also use them as a huge part of our treatment. So again, it's a skill that is honed over time. It's an art. We always talk about the art and science because it's all evidence-based scientific techniques that we're applying. I know that people in the past, I would say, when I was studying physical therapy for people, many of the studies, to our chagrin, were done with animals.
Right.
And so it's like, well, duh, if we prove with an animal that it worked for people, then let's reverse that and know that it works with animals. And we were talking about exercise, and I think the first thing that I think about is function and what it takes to optimize function, whether it's a person or a pet. And many times that requires determining if there's pain, and if there's any pain, that pain needs to be minimized. Because if you're hurting, you're not going to be able to do anything. You're not, again, thinking about you yourself, you're not going to be able to focus. You're not going to be able to work. You're not going to be able to do your sleep. Sleep is a huge one, and getting restful sleep. You may not be able to do your daily hygiene, take a shower. You may need help getting out of bed. I think about those back pain individuals that, it's incapacitating. So the first thing that we all do is determine if there's pain, where is that pain coming from, and how can we reduce it? So then we can do other things that in the long term will prevent that pain from coming back. So it might be a stretch, or it might be, strengthen this and creating balance and symmetry throughout the body. But yes, it's a whole picture thing. One of the reasons, Kathy, that I changed careers is that with people, our healthcare system has really become a sick care system. We wait until there's a problem and then address it. And we need to shift that mindset and think truly about it being healthcare, focusing on prevention and wellness. And because, at least when I started out, much of the animal care was not insurance based. So I could do whatever I want, and I still do, to prevent injury, to work on wellness. I couldn't get paid for that as a physical therapist.
Mhm.
And, so we, like I said, working with little Aurora at 7 months and preventing injury, working on that wellness piece of it.
Right.
And then at the opposite end of the spectrum, all the changes that go along with aging, and what is a good death, and how do we die with dignity, and maximizing function to the very end, and that independence.
Right. Yeah, that's what we all want. That's what we want. Yeah. So the principles are very similar, really.
Very similar. Very similar. Yeah. I hope I've provided enough examples that it's clear.
So, Chris, let's circle back a little bit to the communication piece about with regards to your animal patients.
Sure. And I think when we did our podcast about pain, we talked a lot about the signals that animals will give us, and it's just a matter of tuning in and learning what those signals are and what they mean, like we talked about earlier with pediatrics and so forth. So, their body language is so important, and being able to interpret that. And I think one thing, Kathy, you took the fear-free certification,
right?
And so that's all about listening and getting buy-in from your pet. How do you interpret what their reaction is to what you're doing, and should you proceed forward or not, and making things as comfortable and, again, positive as can be. So there's both a program for veterinary practitioners and certification in fear-free, as well as it's called like Happy Homes or something like that for pet owners. So really good information there. So Kathy, I remember years ago, I was working with a trainer with my little dog, and this just always stuck with me. And she said, when you ask your dog to sit, which is, like number one thing we teach our puppies and dogs, right, for manners, she said, it should be an invitation, so, Fluffy, sit. She said, how many people do you hear going, and she goes, would you sit? If you go over to somebody's house and they're like, hey, have a seat, let's chat, or would you sit down. So, I think oftentimes putting ourselves in our pet's shoes, we can really change how we speak to them, slowing down, talking softly. There's a time and a place for a sharp tone and so forth, but, it is a lot about body language, moving slowly, taking our time, asking permission, but just being really, really aware of all of those things.
And isn't that the whole joy of having the pet or the pet patient, is making that connection? That's the joy in it.
Yeah.
I want my dog to trust me, and I want to have this bond and relationship with him, and I don't want it to be broken down with harsh, behavior on my end, harsh correction, and that's the whole point of it, is to have the joy and connect.
Yeah.
That's the whole purpose.
And again, I think it's a realization thing. Like, people don't even know that they're doing these things, they're just
right.
without thought, or, mimicking, maybe their parents or whatever in their relationship, and so it carries through. And, but really just taking a pause, stepping back. And when your dog isn't, shall we say, complying, it's probably something we're doing, not, it's not their fault.
Yeah.
And so, that I just, in our world, Kathy, of rehabilitation, we have to be so cognizant of that. And when we use modalities, again, like getting into an underwater treadmill, how terrifying that must be.
Right.
For a dog to go in and be closed in this box and water start to fill up from underneath. So we use, a treadmill that has some water in the bottom, covering the belt, and they walk on it in the water. We get a lot of bang for our buck. It's one of the gold standards of rehab. But again, just don't assume that they're just going to go in there and be like, this is just great, So, and the other thing I think about too, when we first started out in our career, I remember we were taught how to use electrical stimulation, and I didn't even use that as a therapy much for my human patients because it hurts.
Right.
You're putting an electrode on a muscle where it, typically where the nerve dives into the muscle, so it activates, it falsely creates a muscle contraction
Right.
through the use of electricity. Think about if you've ever been shocked, touched an electric fence, it's very noxious.
Mhm.
And so that's one of the reasons I can't even tell you the last time I've used E-stim. I didn't feel like I got great results from it. I couldn't communicate with the pets and say, this is why we're doing it. It's only going to hurt for 15 minutes. And switch to things like using light therapy, photobiomodulation,
Right,
which has
right.
no negative effect whatsoever.
Right,
We don't have to shave them like we do with ultrasound or E-stim. They don't get wet like they do in hydrotherapy. It's just a great modality for the reasons that we're talking about.
Well, thank you, Chris. We learned a lot today about the parallels between, physical therapists and their human patients versus their animal patients. So is there anything you would like to leave the audience with?
Yeah, I think the big message is that if you, as a pet owner or veterinary professionals, have ever had physical therapy for yourself or know somebody who has, think about advocating for your pet through the use of physical rehabilitation. We can treat so much and help so much, and we are develop that relationship. That's one of the reasons why I became a physical therapist as opposed to a doctor, because I thought, a doctor may see their patient once a year, for an annual exam if all is going well. But as a PT, we would see our patients regularly. And I like developing that rapport and that relationship, as we've alluded to. Yeah. So, it's not, some of the, again, negative raps that we get out there is, no pain, no gain, physical terrorists, pain.
Oh my gosh, I haven't heard that one. Wow.
Oh yeah. PT stands for pain and torture. And that is so far from the truth. So I guess that would be my biggest take home message, is that physical therapy does not hurt, should not hurt, and that we're all about, restoring and maintaining function and minimizing pain. And we can do the same with our animal friends. And who doesn't want that?
Right. And who doesn't want that? Thank you, Chris. Can you let people know where they can find you?
Well, certainly. The only place to find me is through this podcast on Petability. So I'm trying to slow down a little bit, but for that reason, I don't have a website or anything like that. But people still manage to seek me out, which I love. And but the best place to find me is on the Petability podcast.
Fantastic. Thanks, Chris.
Thank you, Kathy. I hope I didn't disappoint. All right.
You did not disappoint. Thank you. Bye.
Take care. Bye-bye.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
For more information about Kathy's books and living with blind dogs, please visit enableyourpet.com. Thank you, and please tune in next time.